The majority of men who present to a specialist like myself with erectile dysfunction, we can absolutely treat. There are men who are so embarrassed and dissatisfied with their inability to have a more intimate relationship with their spouse. For men who are even up to 80, but really miss having a routine, regular, spontaneous sex life, no reason why they can't undergo a 1.5 inch, 1 hour procedure to have an implant placed. We have men to see the anesthesiologist and see their doctor before we do elective surgeries. And so if someone's considered a poor operative risk, then we wouldn't do it. But if someone's considered by the experts to be a reasonable operative risk, there's no reason why they couldn't do it despite their increasing age. There are some fears that men have with the penile implants. The fear is that it's going to be obvious to people that they have it. Not true. A well-placed penile implant should take about 45 minutes to an hour to put in, should be through one small incision, and it should not be visible. So most men choose the 3-piece inflatable device. It has 2 cylinders, look like straight inner tubes that are placed into the penis. The 2 cylinders are connected to a pump, and this small pump sits between the 2 testicles. So you can't see it, but you could easily feel for it. And it has a pump on it, so when you squeeze the pump, it basically transfers fluid from a reservoir and pump, 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 pump. And the harder you pump it, the harder your penis gets. And it stays up until you hit a release valve on that same pump to make it go down. So the reason why there's so much satisfaction with an implant is that if you wanted an erection for 3 minutes, 7 minutes, 28 minutes, an hour and a half, it doesn't go down until you hit a release button and allow it to go down. Men go home after 24 hours in the hospital with pain medicines by mouth. Usually it's not disabling, you're just uncomfortable. I'll see them back in 1 week just to make sure the wound's healing fine. At the 3-week visit, I'll show him how to start to use it. And I would say the great majority of men at 5 weeks are back in business. And it lasts for many years, if not for 10 to 20 years, to provide a very spontaneous, enjoyable, complete, lasting erection.